Robotic knee surgery is a new evolution in how we approach total knee replacement surgery. The conventional total knee replacement surgery is carried out through a physical assessment by the surgeon, an X-ray, and the surgery performed by manually templating and referencing and measuring and deciding how much of the knee should be resected at the time of surgery. And obviously there's a variation in how surgeons do this. With robotic knee surgery, a CT scan of the knee is taken, which is highly detailed, and then this is fed into a computer program, and this helps to pre-plan the surgery to a much more accurate level. And during the surgery, a robot is used to help perform the total knee replacement surgery. The use of robotics in this particular evolution is a completely new philosophy in how we approach knee replacement surgery. Due to the CT scanning in a three-dimensional model of the patient's knee, much more accurate pre-surgical planning can take place, and so we can decide to the millimeter how much bone should be resected and from where, and this can be done live in the middle of the surgery as well. The robot is there to assist the surgeon, so the surgeon still does the surgery, but the robot restricts how much bone can be removed from the knee, and the cutting of the bone takes place in safe zones out of which you cannot travel. So it's actually revolutionized total knee replacement surgery. I operate with the Stryker Mako robot, which is the most advanced total knee replacement robotic system in the world at the moment. There's plenty of research and data now to support the use of this as being superior to manually done total knee replacement surgery. No, the entire process is not done robotically. The pre-surgical phase is the same. You'll still see me or a specialist knee surgeon. Once the CT scan has been carried out, myself and the team review the CT scan in detail and make a surgical plan, and then interoperatively some arrays are placed on the femur and the tibia, so the robot knows and I know exactly where the knee is to the millimeter in space and time. The approach to the inside of the knee is the same, and the robot is then used to help make the bone cuts during the surgery, so they're extremely accurate, which leads to more accurate prosthesis placement, a well-balanced knee, and a better range of movement. Anybody who requires any form of arthroplasty or knee replacement surgery is a candidate for robotic knee replacement. The two types of procedures that can be carried out is a partial knee replacement, and the approach to the partial knee replacement is excellent using a robot. It fits absolutely perfectly and it feels and looks like the patient's own knee, which is great. And also for total knee replacements where the whole knee is replaced. Robotic knee replacement surgery benefits the patient in multiple ways. The most important is that the accuracy of how much bone is removed, and the angles and the accuracy of how the new knee replacement prosthesis is inserted into the patient. And because of this, the knee is better balanced with a good range of movement for that patient. The other things that have come to light after we started doing this kind of surgery is that patients experience less pain afterwards because there's not any unnecessary damage to the joint, as it's so much more accurate. Patients are mobile more quickly and they spend less time in hospital after surgery, and all of these are great benefits to the patient. In my opinion, in the next 10 years, robotic knee surgery will increase. As people start to realize the benefits of this, it'll become more widely available, and I think in 10 years' time, almost all knee replacement surgery, especially in Western countries, will be robotically assisted.